Hello and welcome. Today we'll be diving into a rare and fascinating neurological condition, Bickerstaff's brainstem encephalitis, often abbreviated as BB. We'll explore what it is, what causes it, how it's diagnosed and treated, and what the future holds for those affected by this intriguing disorder. The exact cause of Bickerstaff's encephalitis remains a subject of ongoing research, but it is widely believed to be an autoimmune disorder. This means that the body's immune system mistakenly attacks its own tissues, in this case, parts of the nervous system. In many cases, BBE is preceded by a respiratory or gastrointestinal infection, suggesting that the immune response triggered by the infection may, unfortunately, react with components of the brainstem. While specific infectious agents haven't been definitively linked, certain bacteria and viruses are suspected of playing a role in triggering this autoimmune cascade. In Bickerstaff's brainstem encephalitis, the autoimmune attack primarily targets the brainstem, the vital structure connecting the brain to the spinal cord. This attack often involves the production of antibodies that target specific components of nerve cells, particularly gangliosides, which are fatty molecules found on nerve cell membranes. The presence of anti-GCOMB antibodies is particularly characteristic of BBE, although not all patients will test positive for them. Damage to the brainstem and cranial nerves disrupts the normal transmission of nerve signals, leading to a range of neurological symptoms. The cerebellum, which coordinates movement, is also frequently affected, contributing to difficulties with balance and coordination. In some cases, the spinal cord may also be involved. Bickerstaff's brainstem encephalitis is a rare condition, and accurate epidemiological data is limited. Its prevalence is estimated to be extremely low, affecting perhaps only a few individuals per million. BB appears to occur worldwide, with no specific geographic or ethnic predisposition identified. It can affect people of all ages, but it seems to be most commonly diagnosed in young adults and middle-aged individuals. Due to its rarity and the potential for misdiagnosis, the true incidence of BBE may be underestimated. The hallmark signs and symptoms of Bickerstaff's encephalitis are ophthalmoplegia, ataxia, and altered consciousness. Ophthalmoplegia refers to weakness or paralysis of the eye muscles, leading to double vision or difficulty moving the eyes. Ataxia involves impaired coordination and balance, resulting in unsteady gait and difficulties with fine motor skills. Altered consciousness can range from mild drowsiness to coma. Other common symptoms may include weakness in the limbs, facial weakness, difficulty swallowing, slurred speech, and sensory disturbances. The specific combination and severity of these symptoms can vary from person to person. Diagnosing Bickerstaff's brainstem encephalitis can be challenging due to its rarity and overlapping symptoms with other neurological conditions. The diagnostic process typically involves a thorough neurological examination, evaluation of symptoms, and a review of the patient's medical history, including any recent infections. Magnetic resonance imaging, or MRI, of the brain is crucial to identify any inflammation or lesions in the brainstem or cerebellum. Cerebrospinal fluid analysis, obtained through a lumbar puncture or spinal tap, may reveal elevated protein levels and inflammatory markers. Blood tests can be performed to detect the presence of anti-GCOMB antibodies, although their absence does not rule out the diagnosis. Nerve conduction studies and electromyography, EMG, may be used to assess nerve and muscle function. While Bickerstaff's brainstem encephalitis doesn't have rigidly defined subtypes, it is often considered to be part of a spectrum of autoimmune disorders affecting the nervous system. This spectrum also includes Guillain-Barré syndrome, or GBS, and Miller-Fisher syndrome, or MFS. Miller-Fisher syndrome is characterized by ophthalmoplegia, ataxia, and areflexia, which is the absence of reflexes. Some researchers believe that BBE, GBS, and MFS represent varying degrees of involvement of different parts of the nervous system by a similar autoimmune process. Patients may exhibit overlapping features of these syndromes, making precise classification difficult in some cases. The primary goal of treatment for Bickerstaff's encephalitis is to suppress the autoimmune response and reduce inflammation in the nervous system. Intravenous immunoglobulin, or IVIG, is often the first-line treatment. IVIG involves administering high doses of antibodies from healthy donors to help neutralize the harmful antibodies attacking the nervous system. Plasma exchange, or plasmapheresis, is another treatment option that involves removing the patient's plasma, which contains the harmful antibodies, and replacing it with healthy plasma. Corticosteroids, such as prednisone, may be used to reduce inflammation, but their effectiveness in BBE is not definitively established. Supportive care, including physical therapy, occupational therapy, and speech therapy, is crucial to help patients regain lost function and improve their quality of life. In severe cases, respiratory support, such as mechanical ventilation, may be necessary. Because Bickerstaff's brainstem encephalitis is believed to be triggered by an abnormal immune response following an infection, strategies to prevent infections, such as vaccinations and good hygiene practices, may be helpful. However, there is no specific, proven method to prevent BBE. Given the suspected role of autoimmune mechanisms, research is ongoing to identify potential targets for immunomodulatory therapies that could prevent or mitigate the autoimmune attack on the nervous system. The prognosis for Bickerstaff's brainstem encephalitis varies. Many patients experience significant recovery with treatment, but some may have persistent neurological deficits. The degree of recovery depends on the severity of the initial symptoms, the timeliness of diagnosis and treatment, and the individual's overall health. Relapses are rare, but they can occur. Recent research efforts are focused on identifying specific biomarkers that can predict disease severity and treatment response. Studies are also exploring the role of specific antibodies and immune cells in the pathogenesis of BBE, with the aim of developing more targeted and effective therapies. The development of new diagnostic tools and treatment strategies holds promise for improving the long-term outcomes for individuals affected by Bickerstaff's brainstem encephalitis.